Vitamin D. It's the sunshine vitamin, and it's one of the 4 fat-soluble vitamins, and it has a lot of important functions in the body, but there's a lot of misconceptions about it, starting with myth number 1. Sun exposure alone is sufficient to get all the vitamin D that you need. The reality is there's a lot of different factors that determine how much sun you need to get adequate vitamin D levels in your body. The sun is, of course, a natural source of vitamin D. When ultraviolet rays hit our skin, that stimulates the production of this vitamin, but this process is influenced by different factors like your geographical location, as people living farther from the equator end up making less vitamin D. Other factors include the time of the year, the time of the day, the amount of air pollution, and even your skin type. People with darker skin have more melanin, which reduces the skin's ability to produce vitamin D. And the more clothes that you're wearing, the more sunscreen being applied on the skin, the less vitamin D your skin will make. So it's hard to know exactly how much sunlight you need on any given day. Myth number 2, only those in cold climates with limited sun exposure are at risk of vitamin D deficiency. The truth is, even in warm, sunny locations, vitamin D deficiency is still quite prevalent, partly because of the modern lifestyle with people spending more time indoors. Myth number 3, all vitamin D supplements are equal, with all of them providing the same benefits. In reality, vitamin D supplements come mainly in 2 forms. There's D2, which is ergocalciferol, and D3, which is cholecalciferol. While both can increase vitamin D levels in the blood, studies have shown that vitamin D3 is more effective in sustaining these levels over time. Not only that, but vitamins and supplements in general, they can have different purities and different levels of various contaminants and so forth. So a good place to check on the best brands that you can buy would be Consumer Lab, where they independently test different brands of supplements, including vitamin D. Myth number 4 is vitamin D is only important for strong bones. While it's true that vitamin D has a big role in facilitating calcium absorption for bone health, it also plays a major role in immunity, and other research suggests that it might protect against heart disease and help fight depression. Myth number 5, only the elderly and those with bone conditions need to worry about vitamin D levels. It's actually a dangerous assumption that only older adults need this nutrient. Children and adolescents require vitamin D not only for bone growth, but also for overall development. Deficiency in younger years can actually have long-term implications on one's health. Myth number 6, the more vitamin D, the better. While it's definitely important to avoid being deficient in vitamin D, more isn't necessarily better. In fact, over-supplementation can be harmful. I've seen many patients who have elevated calcium levels because they were ingesting too much vitamin D. When excessive vitamin D elevates calcium levels in the blood, that can lead to vascular and tissue calcification with potential damage to the heart, to the blood vessels, and even the kidneys. And very high levels of calcium can cause heart arrhythmias. Myth number 7, vitamin D guarantees calcium absorption. Although vitamin D significantly aids in calcium absorption, other dietary and hormonal factors play a role. For instance, a deficiency in magnesium, which is a mineral vital for vitamin D activation in the body, can hinder calcium absorption. Myth number 8, a deep tan is a sign of optimal vitamin D levels. While a tan might indicate sun-induced vitamin D synthesis, however, a tan is also a response to skin cell damage from UV radiation. Depending on skin type, tanned skin can sometimes produce less vitamin D than untanned skin when exposed to the same amount of sunlight. Myth number 9, unless you're experiencing obvious symptoms, you're not deficient. Vitamin D deficiency can be silent, showing no clear symptoms. The only way to determine deficiency is by doing blood work. Myth number 10, food sources provide enough vitamin D. The truth is, there's actually very few foods that naturally contain significant amounts of vitamin D. While fatty fish, fortified dairy, and egg yolks have some, achieving adequate levels through diet alone is challenging for most people. What's considered normal vitamin D levels? Normal vitamin D levels in the blood are usually measured in the form of 25-hydroxy vitamin D, often denoted in the blood work as 25-OHD. The recommended ranges can vary slightly among different health organizations, but in general, for the 25-OHD blood test, the levels are going to be defined or categorized as deficient if they're less than 20 nanograms per milliliter or 50 nanomoles per liter. Insufficient would be 21 to 29, sufficient 30 to 60, and then you have possibly harmful levels if they're exceeding 60, and toxic levels are considered over 100. Keep in mind though that the best range can vary depending on the individual, the laboratory that analyzes the results, and the reference ranges that are used. Some doctors might target higher levels for individuals with specific health conditions or risk factors. So having a level in the sufficient range doesn't guarantee optimal health for all people, as there can be variances based on individual health needs. This is also why it's hard to give a general recommendation as the amount of vitamin D someone should be supplementing with. The recommended daily intake, it depends on age and individual health circumstances. The U.S. National Institute of Health recommends a daily intake of 400 IUs for infants, so 0 to 12 months, 600 IUs for children aged 1 to 18 years, and then 600 IUs as well for adults of ages 19 to 70. For people 71 or older, that's going to be 800 IUs. For pregnant women or breastfeeding women, 600 IUs. But just remember, these are general recommendations. For instance, if you live in a location with limited sunlight, especially during the winter months, or if you have darker skin, you might need more supplementation.